Part of what I do is I train fellows, and it is a big step. You've now basically given up your young life to become a physician, right? So whereas your colleagues have been out 15 years working, creating a family, you're just starting, and often you're 30, 32, 33 with debt, a young family, a mortgage, and really you want to make sure you're making the right decision. The very first question I ask, and I've asked this before Ken started asking it, but it is, I think, a part of life, is what's the most important thing in medicine? And I do that to make sure that they've made the right decision. And the answer should be having fun. Because you have to have the passion for what you're doing and actually love every single day you get up and go to work. Now, why? Because it's rough out there. The patients are rough and demanding. Generally, depending on where you practice, people aren't waking up in day and saying, oh, thank goodness there's a doctor here. It's very challenging. And it should be about the satisfaction of delivering care in a rapidly evolving paradigm where the hospital isn't sure what they should be focusing on and your practice isn't sure what they may be focusing on. So if you don't have the anchor that you just love what you're doing, then you're not going to be happy. Once we're past that, then the question becomes, well, what should I be doing? What you need to be finding is the niche that you get the most enjoyment. And as it pertains to nephrology, we have basically three big buckets where we operate. There's the hospital bucket. These are really sick people, very demanding. There's a dialysis bucket. And then there's the kind of the CKD clinic bucket. Now, if you try to be all things to all people, you probably can do it. It might be sort of fragmented. But each of these buckets are now getting linked together. You're looking for a venue where you can do what you enjoy. Now, there are large practices where you basically can pick and choose. DaVita is now offering a venue where you can have a relationship with them either directly, working for DaVita, or indirectly through a DaVita managed practice, where you can sort of hit your sweet spot, or you can go off on your own. It is now tough to go off on your own. I mean, I am all about physician satisfaction and finding that niche that works for you, but it is not like it was 20 years ago. I would not recommend you work for hospitals, and the reason isn't that I don't like hospitals, although I think they're generally very poorly suited to deliver the care that a nephrologist would want to deliver. But the reason I say that is hospitals are much better at, I think, delivering general care. If you're looking for employment, I would absolutely suggest that you look at DaVita or a large dialysis organization whose sole focus is on nephrology patients.